Hi, I'm going to give you a brief synopsis of my project, which is the prevalence of SARS-CoV-2 antibody in children presenting with Kawasaki disease, toxic shock syndrome, or myocarditis prior to recognition of COVID-19 disease in the region. These are my co-investigators, and my study coordinator is Varsha Zadokar. This work is supported by a grant from ACCEL. MISC was first described by the CDC as a syndrome on May 14, 2020. Our first patient that we recognize retrospectively had presented on April 12th, and the diagnosis was made by antibody testing. On looking at the number of children presenting with Kawasaki disease, toxic shock syndrome, or myocarditis, we saw an increased number in the first few months of 2020 when compared to 2018 and 2019. Our hypothesis was that some of these children may have been related to SARS-CoV-2 exposure and were not identified because we were not aware that this disease existed at that time. We also hope to assess socio-demographic differences between patients within the different diagnostic cohorts and compare them to other children who tested positive for COVID-19 but who did not have cardiac findings. And also to test antibody prevalence in immediate family members of patients who tested positive for the antibodies. Just a slide showing the increased numbers of those diagnoses in 2020. We've been able to perform preliminary analysis on a subgroup of our patients. There are more testings to be completed, which we hope to complete by February 15th. We have started getting the family members of those who tested positive in for testing as well. We did have some initial trouble with the kits that we received and had to redefine controls for the lab for positive and negative cutoffs. Preliminary demographic data analysis has been started only on the MISC patients as of now. So as you see, a very large number of them are male. The next graph shows the numbers by month. And the last graph shows us the CDC numbers of MISC cases in the country. So a lot more data analysis to be coming in the next few weeks. Thank you for listening to my presentation.